Two of the most important aspects of wellness that we focus on here at Coastal Animal Hospital are being the ideal body weight and having a healthy mouth. Those two things combined can really lead to long-term health in your pets. Let's focus a little bit on dentistry, because chronic inflammation in the mouth, chronic infection in the mouth can lead to a lot of chronic long-term diseases and long-term pain. And so by being preventative with our oral health care, we can really make pets healthier in the long term. In the exam room, there's only so much that I can see on an awake exam. There's a few teeth that I can see, but the most common teeth that's extracted in the mouth is one that I can't see until they're fully anesthetized. So I can give us an idea as to what's going on in the mouth, but it's not until they are under anesthesia that I can fully assess each tooth. Coupling that, we can't take x-rays without them being under anesthesia as well. And so we can take our x-ray findings and our anesthetized oral exam findings and come up with a complete plan that's going to be able to treat their mouth appropriately.
This tooth right here is the most common tooth we actually extract in the mouth. And there's no way that I can see this on a regular examination until they are under anesthesia and we can open up the mouth. And even then, evaluating it can be difficult. But this tooth will look normal, but we'll take an x-ray and there'll be a giant abscess at the root of that tooth, and that's a really common finding. So you can't actually fully know what's going on in the mouth until they're anesthetized, and you can do your exam and make sure that there's no pus coming out from around this tooth and that the x-ray looks normal.
One of the differences when dentals are done here at Coastal, we have two people in the room doing the procedure. There's one person who is doing the cleaning, taking the x-rays, dealing with the mouth portion of the dental, and there's one person who's dedicated to monitoring anesthesia, making sure that they're safe. A lot of places, dentals are done with just one person who's trying to do the cleaning and monitor the anesthesia at the same time. And you can see that it's really difficult to do that well. And you don't want to not do anesthesia well, because that's how you end up with patients who end up having a fatal complication. So you can see with our anesthetic monitoring, all of the values that we are looking at and making sure that all of them are in the right range and right levels. Not only the heart rate, respiratory rate, and that oxygen level, but also our end-tidal CO2, our temperature, our blood pressure. But it's something that we're actively monitoring and making sure stays in a normal range.
So another thing that people ask me a lot about are anesthesia-free dentals. And if I thought that they were any benefit, we would be offering them here, because if we can avoid an anesthetic procedure, that would be great. The problem is they don't actually accomplish anything in terms of improving the health of your pet. They're a cosmetic cleaning, just cleaning the whites of the teeth without actually getting to the root of those problems. Plus, if you don't take x-rays, you can't see whether or not there's an abscess at the root of that tooth, and you're leaving chronic disease behind. So unless they're anesthetized, you're doing an incomplete job of actually improving the health of the mouth. This is what I love about doing dentistry the right way, is because I'll call an owner 2 weeks after doing one of these procedures, and they'll tell me their pet has more energy than what they've had in years. And that proves to us that they were living in pain this whole time, and the dentistry made it better. And nothing makes me happier than that.